We don't have magic results in our job.
You're doctors, by the way, you're not magicians.
I think that the only job where you could be student all over your life, and even if you're 70 years old, is surgeon.
Я Яна Лапутина, и мне очень повезло, потому что я знаю людей из мира красоты не год, два или три, а 10, 15, 20, а иногда даже 25. Мне 37, и я в этом мире с самого рождения. Поэтому имею право, думаю, разговаривать с любым специалистом из любой точки мира. Сегодня мне повезло, у меня пластический хирург из Франции, Бернара, которого я знаю с возраста, мне кажется, 11 или 12 лет. Он уже тогда приезжал в Россию, он написал книгу о разных методах омоложения, и сегодня я беру с ним эксклюзивное интервью впервые за всю жизнь своего общения. Hello, Bernard. I told that I know you for ages, and that you're coming to consult patients in Russia for ages, all over the world also, but generally you practice in France and England.
Yeah.
Could you please tell me about the France always is the chic trends, chic things about fashion, about beauty, about everything. So the most trendy things about beauty in Paris now?
I see that it was always the same thing in France and almost in Latin country, that they want to make a lot of things and having surgery, injectables and everything. And the big law in the Latin country is that people and patients, they don't want anything visible.
Like everywhere, we wake up like this. We do nothing.
I think that in America, for the Anglo-Saxon people, for the English people, it's a little bit different. It's kind of, I have a big car and I've done surgery, and they want
this is the social level thing, right?
And they want it a little bit more visible than in Europe and almost Latin countries.
So Europe and Latin countries, they don't want anyone to see what they do for improving. The Americans and the English, they want it to be for
to show
up, you know, like
the nose are smaller, the cheeks are bigger, the breasts are bigger, and it's a little bit more visible.
And when you're coming for consultations to Russia, and I know that you travel all over the world, of course the Russian women would like to know, how do we Russians look like and what do we want? Tell me. For 20 years, you're dealing with Russian women.
I think that each surgeon has his kind of patient. And I think that if I do the Russian patient who are coming to me in France, in London, everywhere, they want my test and they want also to be natural. So I don't know, unfortunately, all the patients all over the world, all the Russian patients, but the patient I have, they choose me because they want to have a natural result.
Bernar, I will ask you like a tricky question. For me, I know that our market, Russian market, has a huge amount of very talented plastic surgeons and cosmetologists, and still we have a percent of patients who keep on traveling abroad for the injections, for the surgery. How do you explain this? Why?
Because they didn't find very good plastic surgeon where they can trust in it. And I think because 20 years ago or 15 years ago, it was less plastic surgeon here in Moscow, and it's a habit. And
they trust you for like 20 years, they keep on trusting you. Huh?
I think that the more important in this kind of job is to trust your surgeon. Once you trust it, you follow him all the life.
And you follow whatever country he goes.
I think.
How long do you practice? For how many years?
Unfortunately, since
tell us the truth.
30 years.
30 years of practice. During this period, what changes you see? What has been changed?
Everything changed.
Tell me. Tell me.
Everything changed. Our philosophy, the techniques, everything.
Okay, start from the philosophy. What has changed from this point of view? What was 30 years ago and now?
30 years ago, but because of the technique, to rejuvenate a face, for example, we just had the very aggressive eyelid surgery, aggressive facelift, and visible result. And for years we begin to understand that aging is not skin quantity, is not, and it's more a loss of volume than an excess of skin. So with the years we were more by fillers and to fill than to lift first. And then what changed? The product we use changed a lot. When I began my career 30 years ago, we didn't have only gel, silicone, and collagen, and after that we had the hyaluronic acid, more safe, and that we can remove and everything.
Toxins, you have toxins now?
Toxin I do it for 25 years now.
25 years of Botox. Yes, by the way, it's been 25 years of Botox.
It's an old product too. Yeah. Toxin will be old, always toxin. And now we go more on natural products, fat, regenerative medicine, stem cells.
What do you think about stem cells?
I think it's the future. It's a 21 surgery.
But yet it doesn't work good.
Listen, when we inject fat in the face, we inject stem cells. We don't know how. We don't
automatically, you mean?
Yeah, automatically. In the fat there is stem cells. Yes. There is growing factor. And we see that the result of fat, they are natural, not because of the fat. There is something else. Because of the skin quality, the color, the spots.
It's like when you do the plasma. It's quite the same process.
Completely the same.
Yeah.
I think the big difference between plasma and fat. So the stem cells in fat, we call it nano fat grafting. It's not fat, it's the juice of fat.
The natural one, you're telling, not the one which are made specially, like injections of stem cells, right?
No, there is the plasma. It's very easy because you
No, I understand that. But you're telling me when you do the injections of your own fat, automatically you get the stem cells.
Yes.
So these are the, what you call them?
No. And now there is a technique to extract the stem cells from the fat.
Yes.
We call it the nanofat grafting. And it's more rich in stem cells, growing factor, than the plasma. It's less easy to do because you have to harvest the fat, to prepare the fat and everything. But that's the future. I'm sure that in 20 years from here, all the products, the filler will not exist anymore. We'll go on fat. Perhaps we'll take a very little amount of fat, send to a laboratory, it will make syringe with your own fat. I don't know how it will be.
But this is the future. But you know that a few celebrities here in Russia got very serious illness, and it is told that this is because they were using the stem cells. Well, no one is saying this is like 100% so, but when you're taking the history of the patient, you see that all of them have been using the same techniques for anti-aging, for looking good. And
stem cell from where? From the bone?
No one knows. I mean, they don't recall.
At the beginning of the stem cells, 10 years ago, there was a big polemic on breast because we love to make fat transfer in breasts. And they say the stem cells can make growth on cancer and everything. And now all the studies are agree that with a fat injection, there is no more cancer on the breast.
On the breast.
On the face, you don't really risk anything because there is no face cancer, you know, even skin, but
thanks God.
You are dead. So I think that it will change because
no, I think it's they're talking about the injections, you know, IV of the stem cells when they put it into the stomach, something like this. You remember these techniques?
Okay, yeah, but that's not the same technique.
Yes.
Because what we do when we do the stem cells treatment now is during the same session in the surgery room, surgery theater, we harvest the fat, we prepare the stem cells, and we inject in local.
Yes. Yes, you know? I know, we're talking about different things, but yet the technique is not that good. That's what I can say.
The technique, for the moment, we don't know what we do. You know, we act like sorcier.
Like space people, you know, go to the space.
Yeah, we don't
like
know
Armstrong on the moon.
We don't know what we do, but I believe in it. I'm sure it's the future. I'm sure it's when I see the results I have with the fat.
You realize that there is something more than this.
Yeah.
Okay, so in Russia, we got used to the following system that plastic surgeon does the surgery and the cosmetologist does the injections and the lasers and everything. I know that in Europe and in US, plastic surgeons do injections, and I know that you do injections. Yeah. What kind of injections you do, and why do you think it is so? I mean, like, the difference like this?
So first I do ботокс, I do fillers, I do fat injection. I think that it's a good idea to let the surgeon doing the medical aesthetic medicine. Because if you only let nurses or GP or doctors doing aesthetic medicine, they will never think to go to surgery. And they will always do injection. And every 6 months they will see the patient, they will do injection. And you will feel with the patient big like this, because one day when you're a plastic surgeon, you stop injection, now it's the time of facelift, now it's the time of eyelid surgery. But when a nurse do that, they don't want
She doesn't know how to stop.
She doesn't know how, and she doesn't want to stop. It means she doesn't want to lose the patient, she doesn't want to.
But the difference is that, like in US, there is no such a, if you're a doctor, you can be like a surgeon or you can be the cosmetologist. In Russia, we have 2 different specializations in university: plastic surgeon and cosmetologist.
In France too.
In France too. And that's why cosmetologists do the injections and the surgeons do the surgery.
I think that it works if it works in a team.
Like in clinic.
Yeah, because in a team, the cosmetologist can say, stop, now it's surgery time. But when it's individual work, I see that in, for example, in London. In London, the nurse, they are allowed to do fillers, injectables and everything. Really, the results are not really subtle.
So this is the point when you have to stop going from one doctor to another. And I see. The other thing is that social media is now a huge power. And what on your mind is possible to be posted on Instagram for a doctor, and what is impossible, the ethic part?
I think the problem is in social media. When you see the doctors who works a lot on social media, you can't believe in the results. I think a lot of people who show results on social media is very often fake.
You don't believe in Instagram?
I believe in Instagram, but when I see the results of the plastic surgeon, of very famous doctors, it's very fake, because it's Photoshop. Because they lie, they say...
But they have millions of followers.
I know, but that's not a proof.
You don't, by the way.
I don't, but I try to do my real result and not to put fake result. Because the problem of Instagram is so quick that if you don't show a result like, wow, big one, you don't stop on the result, a magic result. We don't have magic results in our job.
That's good.
Yeah, we have subtle results.
You're doctors, by the way, you're not magicians.
Yes.
Some doctors forget about this.
So I'm a little bit skeptic about the big doctors on Instagram because of the results. And
what do you think of these things when the surgeon is in the surgery room with the patient on the table, and he has this selfie stick and saying, hey guys, I just did this and I just did that and we're having so much fun. And the patient is like...
Well, I don't like to show this. And
do you think it's ethic? Do you think it's okay?
No, I think that it's forbidden. It means you have the secret, the medical secret.
But a lot of patients, they buy it. They eat it. Why?
I don't know. Because they want to see that. They want to see how it's going on in the surgery room.
But if it's for me, it's like a meat man in the meat room. Look how I'm cutting the cutlets. Look what I'm doing.
I think there is one in Miami. I don't remember his name. He's on Snapchat, and he posts every day on Snapchat all his surgery.
Yes.
Yeah. Every day. He posts all the surgery.
But is it normal?
No, it's not. I think that should show you results.
But don't you think it should be stopped by legal way?
I think that if you post your results, then when it's not fake result, it's a good marketing. Okay. But the problem, it's very hard to believe some results in Instagram. Okay,
but you have Instagram, I know it. I follow you, by the way. And of course I do. And I never read too much comments, actually. But when you read your Instagram and you read something, oh, you did a horrible job. It looks like it's a mess. You did nothing. What do you feel? To the trolls, you delete, you answer. What do you do?
I answer.
Answer. Yeah. You keep on talking to them.
Yes, because
even
I want
if you know
why.
that it's paid, that somebody is paying for these people to do this.
I prefer to answer. When I have bad
comments,
I prefer to answer and ask why.
But,
do I know you? Da, 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 da. And sometimes it's tough.
but don't you think it's impossible to talk to these people because their level is less than the ground?
I think that it's not good to let bad comments.
And
without
why don't
any
you
answer.
why don't you just delete them?
Because,
Ignore them.
No, because I don't want them.
Okay, in Russia we have a lot of awards which can be bought. What do you think about this?
The word on internet.
No, award, for example, like the plastic surgeons or the cosmetologists, they gather and they get the award, like the best cosmetologist of the year, the best plastic surgeon for the mammoplasty, the best plastic surgeon for the rhinoplasty, and etc.
Yeah.
And it's all paid. What do you think about this?
I think that we don't have to lie. I think that the truth comes from the patient, not from the magazine, not from everywhere, from the patient. You know, the best advertising in our job is the patient you did. She's happy and she speaks with her friend. I think the big quality of my Russian patient, they speak. And they are not close, you know, they don't say, no, I didn't do anything. When they're happy, they speak, they bring new friends, they bring new patients. So it's very easy to advertise.
Well, what you're saying is really goes well to my mind and to my soul because I'm a daughter of plastic surgeon, my husband is a plastic surgeon, I come from this doctor community. But I'm observing the market, and what I see now that these young plastic surgeons with selfie sticks and with millions of Instagram followers, they have a huge amount of patients. They don't know in 5 years, we don't know if they're going to be on the market or not. This is the question.
That's the question.
But this question is never being asked by the patients. They always follow up. The young girls, they follow up the Instagram, okay? But to my mind, it makes the crisis on the market it takes patients from the honored doctors to these young ones. Do you have this trends in England, in France? How do you feel about them, and how should we fight them, or we should not?
In France, we begin to have a lot of competition like this. I think that's more a problem of competition because a lot of young surgeons, they want to be plastic surgeon, so they go in the market.
Because they get money. They think it's easy.
Yeah. And they want to grow very quickly, so they use a lot of marketing things. I'm not sure they will stay for 30 years.
We have to wait 30 years on the market.
Yeah, I think that, more you're on fashion, more you can go down very quickly.
Okay, and don't you think, have you ever asked yourself that, okay, I'm getting old. Maybe I don't get this all new trendy gadgets and marketing things, and they do. Maybe it's not the problem of professional thing. Maybe it's problem of...
not at all, because I think that the only job where you could be student all over your life, and when you're 70 years old, is surgeon. So I feel like a young student. Every year I learn new method. Every year I read new articles. I try to grow up with my job. So I think that it's a very particular job. When you're a surgeon, you have to be a student.
Okay.
All over your life. So I enjoy it because this year I was in 3 different conferences on fat in San Diego, in Korea.
To keep on moving.
Yeah, to keep, because I like to grow with my job and to know the...
Both of us are from the beauty world, and both of us are tanned. The tanning is bad.
Yes, but first I'm brown. And I will, and second, I love sun.
Okay.
So I don't...
So you don't believe in aging with the sun? Or you don't
I
care?
say my patient not to go to the sun, but I don't care to have wrinkles and spots, and it's okay. I prefer to go to the sun.
Okay.
Perhaps because I'm a little bit more old and old-fashioned, but I love sun and I love to be tan.
Well, I also love to be tan and I look fine.
But you are not blonde with blue eyes.
No.
That's very dangerous.
Okay, that's why I'm lucky. Huh?
Yeah.
I'm lucky
when
for
you
this
really
problem.
doesn't have any melanocytes, you have wrinkles, redness.
Bernard, thank you. Finally, I feel better than that I'm not being blonde. Blondes are always being the beauties, and our color girls are not.
But for the sun, it's not a good.
Lucky me.
Skin.
Okay, 5 top no's. No, okay, from Dr. Bernario in beauty. what we should not do. 5 things.
To put too much makeup.
Okay. No makeup at all.
To try to lose weight a lot.
Not to.
When you're 40, 50,
Okay.
if you lose weight and you want to be seen like a model, you will look 10 years more. Mm-hmm. That's the first.
Okay.
Second thing. To try to be objective about their face and not to try to be beautiful with your age. I think that a girl can be beautiful at 80, at 60, at 50, at 30. Mm-hmm. But if you try to look 30 when you're 60, it makes you older. Mm-hmm. That's a big thing. So when you do too much fillers and too much injection,
look at your age. Look on your own age. Don't put on too much makeup. Don't lose too much weight.
Yeah.
And 2.
Don't go to the sun, I will say.
Okay, we'll skip it. And the 5th one. Maybe milk. Maybe don't eat meat.
Yeah, I know. I think that to eat, to be careful when you eat what you eat.
Watch what you're eating.
Yeah, not to go in the industrial food and try to eat natural.
Recently,
because you're made with what you eat. Mm-hmm. Your cells, everything, your skin, your eye, everything. So try to build your body with good things.
Recently, Jennifer Lopez was walking on the Versace show.
I think I heard about.
And she was amazing. She was beautiful. She was wearing such an open dress. And the next day, there were a huge amount of articles saying that 50 is new 30.
I love this word.
Me too. So the 40 is new 20 probably in this calculation.
Yeah.
So tell me, how do women manage to look at 50 like 30 age?
Because they take care of themselves. Because two
Do you have
generations.
to be rich to look like 30?
I don't think so. I think that 2 generations before, at 50, you were a grandmama, babushka.
Babushka.
And you don't take care of yourself. Now my patients who are 50, they take care of themselves, they make sport, they take care of they see what they eat, they do some injection, they put makeup, good cream and everything.
So it's in your head.
And in the brain, they feel younger.
That's it goes from your mind.
Listen, I will get 16 in 1 month.
60.
60. And I feel 35 in my brain.
Oh, then I'm a teenager then. I should be like a teenager.
So, voilà, that's the answer.
Okay, my very last question for today, because I'm sure that you will come another day to Moscow.
Of course.
When you're going to be 60.
Yeah.
I'll see the difference. The most overestimated product on the market of cosmetics on cosmetology. Overestimated. What do you think was?
Radio frequency.
Oh, really?
Yeah, I think because the marketing around this technique is very high, so forget the facelift, you will have a beautiful result with medical radio frequency. I know, but I have to. No, this is different.
Ultrasonic.
Ultrasonic is not radio frequency. Ultrasound. Me in Paris, I use ultrasound because people ask them and you have a small result. Radio frequency, I'd never see a result, but people do them. So that's the machine.
And the best product?
I think it's Botox.
We're done. Thank you. And see you when you're going to be 60 in a few months.
Okay.
Ну а вам пока.